Telehealth, the electronic health record, and also the health information exchange progress. So the California Telehealth Network was actually brought together by the governor of California and a lot of entities throughout the state to come together to create one application to apply for the rural healthcare pilot program through the FCC. When they submit their application, months later, they receive the funding to deploy a broadband network throughout the state of California. We received $22 million from the FCC, but that money was only to build out the network throughout California. It didn't support any staffing or any infrastructure, which is very interesting. I'm sure a lot of you already are aware of those types of funding. How on earth do you pull this project on? We also received about $3.6 million from the California Emerging Technology Fund to bridge the gap between the 85% that the FCC was funding and 100%, so that all sites on the California Telehealth Network didn't have to pay to get that broadband brought to them, and also their monthly broadband rates were absolutely free to them for a 3-year period. And then we received over $10 million in additional funding from our partners just so that we could actually pay our salaries so we could build this network out. There were 4 main goals to the CTN under the Rural Healthcare Pilot Program. Again, to build a statewide infrastructure, to link the CTN to a national backbone so that every state could communicate with each other for help from state to state and also for disaster preparedness, and also to leverage and build on the recent deployments and developments and investments in California, and I'll talk about those in just a second. So the CTN, for you technical people, don't ask me any questions, but here it is. It's an MPLS architecture, and it's a private network. And it's built to give you medical-grade broadband for quality of service and security and privacy. It's also, it does not cross the public internet, so you can't go out on the CTN and access the internet. You have to use something else for that. It's encrypted connections, guaranteed encryption for all CTN member sites. And the equipment and network are monitored by AT&T, the vendor that we have working with the project. And it also is, the bandwidth is robust enough and secure enough to support a whole host of applications, including telehealth, electronic health record, health information exchange, etc. So this is the deployment progress so far. Well, actually, as of March 31st, we have 759 locations connected onto the CTN. Some are from direct connections, and some of them are from connections that come off of direct connections. And we were initially funded by the Rural Healthcare Pilot Program, but now we're transitioning into the Healthcare Connect Fund to keep these programs up and running for actually indefinitely. So the Healthcare Connect Fund, you guys have heard talk after talk about the Healthcare Connect Fund, so I won't go into a lot of details. But the good news is for the existing 750 CTN sites is they can still continue with their, I call it, ludicrously subsidized broadband. So but at just a little less of a subsidy, now they have to pay 65% rather than 0 for the broadband. So the CTN is a membership organization because they don't get any money off of giving subsidized broadband, so how do they support their operations? We're calling this now CTN 2.0. We're trying to create some sort of a sustainability plan. So we have to offer something to our remote sites in order for them to keep paying the $100 a month membership fee. So we're offering assistance, finding telehealth specialty providers. It's one of the biggest questions that I get as a resource center. Who's out there that will be willing to see my patients? We help them with that. Also, the CTN just purchased a statewide specialty scheduling and referral tool, which is huge, and that will save a lot of money to our member sites. So now we're starting to become like a group purchasing organization where we can take the power of the entire state of California and then purchase things and only charge our members' sites just a very small fee. We do video conferencing bridge services, web-based video conferencing platform, desktop support. I pay $100 a month just to have somebody support my desktop. I mean, really. And also, we do all the FCC the filings and video language interpreting services are coming out next. And then they also promise access to the California Telehealth Resource Center, but really, honestly, everybody has access to us. We're cheap. We're already there with them. So the goal of the CTN, obviously, is to make sure that everybody is so hooked on this bandwidth that they can't afford not to have it anymore. So we try to push as many applications and support as many applications on that pipeline as possible. But telehealth is always the first thing that people ask about. So let me tell you what we're doing in California with telehealth so far. The practice models that were really widely used in California are still live video conferencing, both for inpatient and outpatient. And over 45 different specialties or this slide says 40 different specialties and more are frequently used throughout California, but there are 3 specialties that are the hugest need, and I don't know if this is the same for you guys, but it's psychiatry, and psychiatry. And then behind that is dermatology and endocrinology. Are you guys seeing the same thing as far as what your needs are? Isn't that amazing? Okay, we're not alone. And with the live video conferencing, our practice models are usually provider to provider to patient. Now it's turning into sometimes more like provider to patient, and then what we're transitioning towards, and some of the universities are already doing this, is specialty provider to patient home. I mean, doesn't it make perfect sense for, if UC San Francisco is saying, here we are in the heart of an urban city, why on earth would I ask my patients to come in for a follow-up neurology consult if I could just do this to their home and save them that big trip? So that's what they're trying to transition towards now. Also, Storm Forward in the state of California is reimbursed by Medi-Cal, which is our state's Medicaid, but only for 2 specialties, which is dermatology and ophthalmology. And dermatology is going like wildfire, Storm Forward. I mean, it makes perfect sense. It takes you 5 minutes to see a patient. But other healthcare insurance companies and payers are starting to expand beyond the dermatology and the ophthalmology. They're doing Storm Forward psychiatry, Storm Forward hepatology, neurology, endocrinology, Storm Forward sports medicine. I mean, if you can think it, you can do it if you have the right electronic health record, if you have the right system. Oh, I'm so sorry. Storm Forward means in the case of Storm Forward dermatology, you snap a picture of an image, 1 or 5 pictures. You include some information that the specialist wants you to include as far as a physician questionnaire, and then you package it up and you send it through secure email or secure web mail, and then the specialist can then take a look at it at their convenience. And then you think, well, isn't Storm Forward kind of delayed, or isn't it a slower process? But what we were finding with the project that I worked on these last 3 years was I can get a Storm Forward consult response in 4 hours. It's a huge project. If it's done right, then it's going to take forever to do. So the UC Davis is running the California's Health Information Exchange Development Program, and they're calling it CHECK, California Health Equality. So their activities right now is they received $16 million, and they're basically re-granting it. They're spending a lot of the re-granting money on, on accelerating HIV adoption, increasing public health capacity, and what I really like is developing a trusted exchange infrastructure. And that trusted exchange infrastructure is what you guys have talked about, is how do you trust the records are good from another institution? How do you trust that they're accurate? So they're spending a lot of time building that out. They've got, they don't have the whole state covered yet. Well, as you can see, I think our projector was getting tired today. As you can see, there's the ghost of the state, and all those numbers are programs that have received funding for HIE. So basically, they gave out $6 million to get this ball rolling. More than 270 connections were established by the awardees to transmit health information, and more than 15 million lives, or potentially 15 million lives, can be covered by HIE through the awardees, which is 40% of the population. So I think that's a pretty good start. So basically, in conclusion, the widespread adoption of broadband really depends on secure broadband, medical grade broadband, integrated with an electronic health record, and then all wrapped up by the health information exchange. So these are really, really interesting programs. If you want to learn a little bit more, and oh, that does show, that's great. These are the websites for the California Telehealth Network, the Telehealth Resource Center, CalHIPSO, and CHECK. And I think these are really great people to talk to too. If you ever have any questions, they always answer the telephone. Okay, thank you very much.